was the youngest of 11 children born in Mexico. I was born at home with a midwife. I was actually one of 16 children. And my mother raised us to be very self-sufficient, to look for our own resources before going to the doctor. She taught us how to take care of our bodies, our emotional self, our spiritual self. And she also taught us about the traditional medicines, which was something I really learned a lot about as a child, but didn't realize that I had inherited a true, rich legacy of wellness, of a healthy attitude from a woman who didn't have a college education. And she had learned that from her mother. So at the end of the day, I think it's just come full circle. Well, I was introduced to service, just the idea of service, by some Chicano, Latino leaders in California. At the age of 14 or 15, I was told that I had an obligation, and that not only did I have an obligation to serve a community, but my community or any community that I lived in. I was very moved by these complete strangers who told me that, in order for me to get an education as a young Chicana, Mexican-American woman, that I would have to work really hard and that it hadn't been very easy for them. These were people who had marched at San Francisco State, in the 70s. These were people who had really lived, some of the more difficult times in high school and college, whether it was in segregated schools, growing up not really learning about their heritage and their language. I wasn't having quite that experience. Tapping into this network of leaders in California in my adolescence, I knew that there was something really powerful there because I didn't know this history. I knew my own Mexican history, but I didn't know the Latino immigrant history in the United States. And so at the time, I just wanted to serve in some way, shape, or form. Nobody in my family had ever gone to medical school. Nobody in my family had ever at that time gone to a public university in the United States. I went to the University of California at Berkeley, and I moved away from my home. And I had a positive experience as a university student, but it was also very difficult. My family, my brothers did not agree that I should go to medical school or to go to college. Therefore, I moved out. They didn't speak to me for a long time. And consequently, I decided that I would hold off on becoming a physician because I knew nobody at that time who was a doctor. I couldn't convince some medical school that I was the right person for them to say, come here, we will educate you and train you. And so I made it my goal that if I wanted to be a physician, that I would firsthand learn about medicine and about how that connected to my community. So when I started medical school, I went to medical school because I knew I wanted to work in the community. And when I found out that there existed such an entity as community health centers, I immediately talked to everyone I could at the medical school, and I said, all of my outpatient rotations, I want them to be at community health centers in this part of town. And I proceeded to get to know the primary care physicians. This was in Salt Lake City, and there was a significant Mexican-American community there and Latino community. And I wanted to make sure that those contacts were made. And so I initially wanted to do any kind of primary care, whether it were OB-GYN, pediatrics, or family medicine. I decided that the only way I could truly honor my own legacy of my mother and also take care of a whole familia, of a whole family, is to really integrate what I know about my community and my culture, and to make that also part of my profession. So when I was a fourth-year medical student, I came to Cambridge, Massachusetts, and I met a previous physician, Dr. Patrick Egan, who had been here at Greater Lawrence for about 10 years. And he said to me, "Oh, you really seem to like working with this community." At the time, it was a mostly immigrant, Brazilian, Portuguese, and Salvadoran community in Cambridge and Somerville. And he said, "I think you would like Lawrence." And I said, "Lawrence? What's Lawrence?" He's like, "Yes, there's this great, mostly Spanish-speaking community in Lawrence, which is north of Boston." And I didn't believe him. I said, "What could possibly be north of Boston that could have so many Spanish-speaking people?" And when I finally decided to pursue family medicine, I looked at their website, I contacted Dr. Egan, and I decided when I came to interview that even if they did not select me, that I would come here in some way, shape, or form. This experience of having, an almost a monocultural community in terms of the Latino community really affected me, because it felt like home. It felt like this is where my calling is. This is where I will do that work. I think one of my biggest joys is following a patient and learning about the art of medicine with my community. I met a patient my very first week here who had just come from the Dominican Republic, and within a couple of weeks of being here, she was diagnosed with throat cancer. And I got to follow her all the way through her illness, from the emergency room admission to the inpatient hospitalization. All of those visits, I got to follow her the entire time. And knowing her family. I always talk about who loves this person. So for me, learning about who truly cares about this outside of the physician and the nursing team, who is their circle? Who's their personal community when they go home? Who's going to help them with their medications? Who is their navigator at home? And so learning about those networks, and also the joy for me of seeing a patient come back and talking about what they learned about their illness after we had some discussions around education, seeing the patient become fully empowered because they now have information, or they've been suggested a tool to do something with, whether it's now they're exercising, a couple of times a week. Now they've managed to lose some weight. Now they've come to an understanding about their, HIV illness and how it can impact their family. And so I think really seeing them, it's called self-management of their diseases and chronic illnesses, but it truly is about learning to live with that. But how, and seeing the patients live with their illness, but also find some fulfillment in their lives. I think to me that's the ultimate, that's one of the ultimate goals.